felt very safe. It was just, we were there for a period of 3 months between the chemo and the hydration part. Then we moved on to RAS, which is radiation, and we did that in Roseville. And again, the care was excellent. When he became very ill, our phone calls were answered appropriately, and we felt safe and well cared for. Dietary, we had some issues. Wally lost 50 pounds in 2 months. Dr. Bell had submitted 2 dietary referrals at this point, and he was still eating but very poorly. When a dietitian finally arrived at the infusion center, she was abrupt, and I heard those dreaded words, "I have been so busy and we're so short-staffed." We had no follow-up and no help. We also found that the food at the infusion center was a little unhealthy. He had the same choices every time we were there, cold hamburgers and processed turkey sandwiches, which is not good for oncology patients. Most people brought their own food, as we did, and it was a topic of conversation there. Then he was in the hospital. Later, Wally had a feeding tube placed. It was a very dark time for us. He was very ill. We were expecting the pharmacy dietitian, the outpatient pharmacy, to explain the tube feedings, as I have never done them in my career. She arrived with no name tag, gave only verbal instructions, said those dreaded words, "I'm so busy," and was in a hurry and had poor teaching skills. It wasn't a very good experience. Interventional radiology. We went there for the placement of the feeding tube and for his PICC line. They were professional, kind, with excellent follow-up. The physicians were very attentive and very calming to both of us. Inpatient on 5 North Neuro, Larry's floor. Wally was placed on 5 North after he had his feeding tube, and his inpatient experience was wonderful. Larry and Janet Masters, just thinking, Larry and Janet Masters met us in interventional radiology and stayed with me and explained that they'd be taking care of us. This is when he was the sickest. I was exhausted. I planned on sleeping there, but I felt so confident that he would be safe, I went home, which is amazing if you guys know me. Janet Masters and Fran Mel, the night nurse, gave him excellent care, and also the rest of the floor that was involved in this care. Janet spent a lot of time teaching us the ins and outs of the feeding tube, which was very scary to me. He was given a lot of TLC, proper pain meds, and I felt safe, and he felt safe and rested. I couldn't have asked for better treatment. Private rooms. Before our admission, I insisted on a private room, and I felt strongly about this. A patient in a semi-private does not get a good night's sleep. There is no privacy, and there's also infectious issues, I feel. Semi-privates are archaic and not conducive to patients getting better. I'm sure anybody here would not want to be in a semi-private room. It does not promote healing. Home health. After we were diagnosed on Saturday, arrangements had been made for home health in Auburn to call us on Monday. For the feeding tube. No calls. I made 2 calls to the answering service, no return calls. With the help of my colleagues and Janet, I was able to overcome my problems with the feeding tube. On Friday, a week later, they called, but said they could not see me until Tuesday. I told them they were too late. We are now in late January. Chemo, radiation, and hydration are almost done. Feeding tube is in place. Wally has second-degree burns on his entire neck and throat. He has copious secretions with the 60-pound weight loss. With the feeding tube, he has started to gain strength, and his neck is healing. Dr. Blazin, still concerned, sent us to Dr. Mark Singer, Chief of Oral Cancer at Cal Pacific, for a second opinion. She is always making sure he receives the best care. Dr. Singer was very optimistic that he would not need surgery, and we were elated. Finally, good news.